Hi, everyone. Thank you so much for the invitation. It's a pleasure to be here. So here are my disclosures, my background. Also, my mom is a dentist. We are running a family practice in Poland, in Warsaw, and she introduced me to dentistry. But apart from that, I'm a volunteer in the clinic for homeless people in Warsaw. It's the only clinic of its kind which is running in our country. So we are delivering care for free for those in need. And as previously said, I'm also lucky enough to work at Malo Clinic, where we specialize and invented the all-on-4 treatments. And our main headquarters are in Lisbon, Portugal. So here's about my diabetes journey. I was diagnosed with type 1 diabetes only 2 weeks after I graduated from a dental school back in 2018. I was very lucky to get a quick access to the CGM because that happened only 2 weeks after my diagnosis. Nevertheless, I was on multiple daily injections for almost 4 years, and then I decided to try to switch to the insulin pump. First, I didn't like it because it possessed a wire, but then I found out about the wireless pumps like Omnipod, and I decided to stick it to it, and till now I'm using it as an artificial pancreas system, and my control is amazing, and my life has been truly converted after I started using it. So I'm a big advocate for this technology among the people with diabetes because it resembles the life without diabetes as close as possible. So today I would like to talk about the different experiences when it comes to oral health among the people with diabetes and the challenges we face in our daily lives. So as you can see in different Facebook groups, there are a lot of testimonials from the other people living with diabetes who are struggling not only with diabetes, but also their oral health problems. In my opinion, this is an issue which is often very neglected in diabetes care. So it would be really good if we could do more effort to prioritize this care. And I believe that dentists are truly a part of a multidisciplinary team when it comes to diabetes management. So here is a short summary of all of the challenges that people with diabetes are going through when it comes to oral health, and I'm going to talk about them today. So as Dr. Sanjita said previously, we know that with poor glycemic management, there is more likelihood of periodontitis and gingivitis, which could affect our oral health. But how does it look like from the person with diabetes perspective? So imagine that you have diabetes. It's 3 a.m. somewhere in night in the world. You are sleeping. And then it happens, it's 3 a.m. in the morning, hypoglycemia hits. You are shocked and tired. And it's endless because you know that you are going to live with this disease for the rest of your life. So the first thing you do to treat the hypoglycemia is basically looking immediately for orange juice. Once you consume it, you wait for your blood glucose to rise, and you are just checking your CGM as often as possible or checking your glucose. But do you really think anything about your oral health at that point? Not really, because you are so tired and it's just another night of living with diabetes. So at the beginning of my life with diabetes 6 years ago, I was struggling with that a lot because these night hypos were very tiring. I was just wondering how many people in the world are in a similar situation as myself. And at that time, I decided to write a master thesis about it. I just asked a simple question to my audience. Do you do anything after an episode of hypo related to your oral health, or you are just going to sleep? As you can assume, majority of the people were so tired and so exhausted from the hypoglycemia that they just decided to fall asleep. But how this could translate into their oral care? We know that the consumption of acids, which is prolonged, contributes to erosion and the caries. So So basically, these kinds of episodes are giving the perfect substrate to develop all of the oral health disease. And here's a case of a person who is 37 years old. She's a non-smoker, diagnosed with diabetes 20 years ago. She's using CGM, multiple daily injections. And that's how her mouth looks inside. That's her OPG. You can see this person has only 37 years old, and she actually had access to the public dental care. So what does it mean? I believe that we should put more emphasis on the caries risk assessment in our practice, and for doctors who are diabetologists, I think it's very crucial to recognize the first symptoms of periodontitis among their patients, so like swollen red gums, bleeding, drifting of the teeth, or receding gums, and then you can be the first point of contact to refer this kind of group or patients to the dentist. And of course, periodontitis is a chronic disease, which is when one is developed, it wouldn't be reversed, but we just try to make things better, not worse than they are. So, as you can see, these are guidelines from the UK. The oral health and the dental care among people with diabetes is getting more attention, and it's more important. Also, in Europe, we have toothpaste with a higher amount of fluoride. I know that the situation differ here in India a little bit because you have limited amount of fluoride that could be included in toothpaste. But that could be one of the solutions for these people who are the most vulnerable. Also, using mouthwash daily could contribute to sustaining better oral health daily, and also educating your patients about the potential accessories that they can use to improve their oral health. You can show them the animations which are prepared by European Federation of Periodontology. If you click on the QR code, you will be taken directly there. And I also really like this diagram, because if you show your patient that he or she would have a wound like this on their hand, they would immediately seek the help and support of the doctor. So why, if their gums are bleeding, why they don't do nothing about that? And yeah, the Economist prepared a really good report regarding the correlation between gum disease and systemic health, and also the expenses which are associated with it. The other thing we are suffering with are the fungal infections. So here's 27 years old female, which was diagnosed only 6 years ago, now 7. Her HbA1c is around 7.5, and as you can see, she's already using the upper denture. So that's how her teeth look like right now. And here is this fungal infection. So, do we really need to ask our patient just one question when they are coming to visits, whether how good their control is? Not really. I think we should really dig into their personal problems and matters. Ask also about their HbA1c or time in red, which is very common among people who are using continuous glucose monitoring. When they come for a visit, whether they are aware of their hypo symptoms, do they have any food to help themselves when they experience the hypo in the office, and whether they even have to check their phone. Remember, my colleague was treating my teeth the other day, and I was looking at my phone to check my blood glucose, and I've just been told off by her that I'm using phone during dental visit. And that was my colleague, and I was feeling very bad whilst being a dentist. So I cannot imagine how someone who isn't can feel, right? So this is something we are preparing with a team from King's College London, as well as with the diabetologists who are working in the UK. It's a diabetes hub. It's going to be a website solely dedicated to all of the things related to diabetes and periodontology. There are going to be 3 sections, one for patients, the other one for healthcare professionals, and the other one for dentists. So it's going to go live next week or in 2 weeks, fingers crossed. But meanwhile, you can subscribe yourself here if you'd like to get the alerts. Also on Twitter, I'm running the hashtag DM Oral Health, where I collect all of the materials, articles related to oral health and diabetes, so you can find it. And my conclusions, I think the collaboration between medical and dental fraternity is essential, as well as routine dental checkups. And that's actually the testimonial of one of my colleagues who's also living with diabetes after his wisdom tooth removal. So I think we should really strive to that. And yeah, if you have any questions or would like to remain in touch, here's my contact. Thank you very much.
So, doctor, I would like to ask one question.
Yeah.
Like, for example, if a diabetes patient comes, I'm like, is there any protocol for, like, medically I'm talking about, if a patient with diabetes goes to a physician and what his, body check is done? So, is there a protocol that if you are having diabetes mellitus, you always have some checkups, like a standard checkup, like first go for eye checkup for the skin checkup, protocol, cardiovascular checkup, and everything. Does the dental checkup include in this protocol?
Some countries, yes, like UK is trying to introduce that, and it happened when they introduced the latest NICE guidelines. But still, in the other countries, we are striving to improve this awareness among physicians and dental colleagues.
As of now, it is not documented anywhere.
Not yet.
It is compulsory, it has to be done, and that should we should include.
Yes, that's a gap which needs to be fulfilled.
So since you are playing the other country, entire country, I just want to ask like if a dental patient comes to you, so as a dental is going myself, if a dental patient comes to you, with a dental patient, so if she you come to know that she is having diabetes, so what is the first to get a patient or simultaneous treatment of diabetes or first to get a treatment? So what's the protocol is?
So first thing I do is I check HbA1c. Actually, I'm quite lucky because at our practice we have HbA1c device, so we can do it on site. And then, in case if HbA1c is increased above 6.5, we are referring this person to their physician for a better management of diabetes before we commence any dental treatment.
Okay, thank you so much. It was a wonderful session. Thank you.
Thank you.
Thank you, Dominika. She herself is being type 1 diabetes, and that is an experience, and thankful to you to have shared this amongst us. I think we would request the next speaker, Dr. Surjadeep Sen Gupta. He would be speaking on impact of diabetes medications on oral health, focus on metformin and SGLT2 inhibitors. Please welcome with a